To that point, new worries rising over COVID-19 as a new medical study says even the COVID booster shots are not as effective against the dominant Omicron subvariants. Meanwhile, the Biden administration making rapid COVID tests available for free again this winter. Here with more, we've got Yahoo Finance's Anjalee Khemlani. Anjalee.
That's right, Akiko. As you mentioned, that study coming out looking at the efficacy of these boosters and of monoclonal antibodies against the newest variants that we know are dominant today. 72% of cases now with that BQ1 family. And that is a concern when it comes to new cases, especially in the old and vulnerable. The really good small bit of news here is that boosters remain protective against severe disease and death, especially for majority of the population. So that is the sort of like one shiny moment in all of this. But we already know that monoclonal antibodies have all but been done away with. The FDA saying on November 30th that the very last one that was on the market is no longer protective and can no longer be used against the subvariants BQ1 and BQ11, the two that are combined the dominant force right now. We also know that Paxlovid remains the only treatment available, but it also is only targeted at a subset of the population. Paxlovid also just got a renewal with 3.7 million more courses available, purchased by the U.S. government, and that is in addition to 20 million courses already available. Meanwhile, as you mentioned, new round of at-home tests available for the for residents of the U.S. You can go through that same USPS route to get at least 4 at-home tests available to you. In addition, it's also important to point out that CVS and Walgreens are still providing up to 8 tests covered by insurance right now. So a lot of focus on this is all a focus of the White House's plan to help try and curb a winter surge, which many experts are saying really is still ahead, even though we're already seeing some traces of that right now.
It's certainly worth remembering. I know that obviously talking about COVID has sort of fallen onto the back burner. It's still very present. And as you mentioned, that people need to pay attention with the boosters and the tests available. You also mentioned, of course, in the middle of winter, and of course, there's now also a shortage of cough syrup.
That's right. If you look at the shelves of any of the local pharmacies and retailers, there is a shortage of cough syrup, flu medication, and that's been actually happening for some time. As we know, the rise in cases in RSV as well as flu in the pediatric population had resulted in that shortage. Hospitals were struggling, providers were struggling to get their hands on these for their patients, and now that has bled over in the adult population as we start to see the climb in hospitalizations as well as sickness related to flu. So really just, that triple pandemic we've been talking about, that triple outbreak, it's happening.
And just a reminder to myself, Anjalee, to get that flu shot as well.
Yes.
The one that I have been missing so far. Thanks so much for that.